So I want to welcome everyone here. About a week ago, we had a conference here and we talked about staying calm, taking certain steps not to spread this coronavirus 19 around, what to do in public. And yesterday morning, myself and Mayor Sheen had a press conference on the parade, and we said things are going to change hour by hour. We've been getting updates. Like I said yesterday, we had an update from the White House at 1 o'clock and then from the governor's office. And things rapidly change, and we talked about that if we had to cancel the parade, we would, and we could cancel it up to 2 minutes prior to the parade kicking off. But at that point in time, we had no cases of the corona. Last night, and I want to commend Dr. Whalen and her staff, we got notified, and they stayed there pretty late. We stayed around the night and working and figuring all this out. We have 2 cases here in Albany County. One's a 30-year-old woman, and one's a student, a 20-year-old student. The little difference of this case is, and the doctor will talk about it, is the fact that they didn't do any traveling. They didn't go anywhere. They were here locally. So it causes a variety of other issues that we're addressing, and we're crossing our T's, dotting our I's. And we weren't trying to be vague this morning, but when we found out last night and working through the night and all morning, we want to make sure we had our facts straight and get it out to the community. So I'm joined here with Sheriff Apple from the emergency standpoint, Dr. Whalen from our health department, and I have Dan Lynch, our deputy here, and George Penn, our operations, and Mayor Sheen, because it is working in a partnership, but having a solid front of how we're going to address this issue going forward, and the steps and precautions that we're going to be taking as this evolves. And I can assure the media here and everyone in the room this is going to continue to evolve. And we've been working with the governor's office. I commend the governor for being proactive, for being one of the most proactive governors in this nation, for his leadership. I can't thank him enough, and for their constant communications with not just our health department, with my offices and everyone else. And we'll be back briefing them on more what's evolving as this continues. So we're going to be doing more of this. This is going to become the norm. You're going to see more press conferences. You're going to see more of us putting stuff out there. And the steps, like we said when I was with Mayor Sheen yesterday, and we talked about, look at, if you're not feeling well, stay home. If you have any questions, don't read the internet. Go to your local media, go to the CDC website, go to the state website, go to our health department website. Go to a trusted site to get your information, because a lot of things that are going on now is people are putting so many false rumors out there, it bogs our systems down. The same reason why we didn't announce anything right away in the morning till we got all our facts straight, so we didn't receive an inundated amount of phone calls and emails to address. The 2 effective areas that we are addressing is the city of Albany and the town of Gilliland. That's why Peter Barber's also joined us here today, because that's where the 2 cases are out of. But this is going to be an ongoing thing, and we have to remain calm. We have to keep our heads, and we have to continue to address this on a manner that the governor's been doing in other areas of the state, in New Rochelle, down in Westchester County. And again, like I said, I could have you all back here in 45 minutes or an hour as things continue to change. That's why we're waiting to see where we're at and where we're going to be heading after this point in the news conference. But I can assure you our EOC is up, and Sheriff Apple can talk about that, and we're ready, and that's what we can do. So I'm going to turn it over to Dr. Whalen to talk about the 2 cases, and we'll go from there.
Thank you, County Executive McCoy. I can confirm that last night the Health Department received word of 2 positive cases of COVID-19 in Albany County. We received this information last evening and had staff in the department working till past midnight to begin our investigation. What we know is that we have a gentleman who is in his early 20s who currently lives in Albany. He is a SUNY student. We communicated this information with SUNY, and I believe that there has been a communication sent to the university community this morning. SUNY has closed for the day. We will have further information and guidance and be speaking with them throughout the day. As you are all aware, SUNY, as a precautionary measure, did suspend classes starting, I believe, March 23rd, and will be doing distance learning. This may be changed based on what happened today, but we'll have further information on that after we speak to those officials. We also have a woman who is in her 30s who resides in Guilderland who tested positive. Information on contacts of these cases is being amassed by the health department staff so that we can ensure that contacts receive appropriate guidance about quarantine. All contacts will be followed by the health department. I can share with you that neither of these cases were hospitalized. I can share with you that both of them are currently recovering at home. And we will have further information available as this unfolds. But as of right now, this is still a very active investigation. The health department staff, as I said, have been working on this through the night and continue to work on this today. We are in contact with our local hospitals who are interested in taking a proactive approach with us. As you're hearing about in the media and from the governor and others, this is a rapidly evolving situation across the state and across the country. What's happening in New York is that we're really looking at expanding the number of tests that we're able to do. And as we expand the number of tests, the likelihood is that we will find more positive cases. So as of last Friday, the cases that can be tested no longer go through the county health department. They can be made at the discretion of a doctor. We know that there are private labs that are ramping up to do the testing, and as we have the availability of more test kits and more labs that are doing this testing, there will be many more tests done. This is a good thing because it gives us a better idea of how this disease is present in our community and will aid us in the mitigation efforts that I talked about during the press conference last week. There'll be a lot of additional guidance and considerations coming forward in the near future, and we appreciate the partnership with all of our local emergency preparedness staff, our hospitals, our primary care providers, and others. As we have said previously, this is going to require a unified front. I believe that we have put the pieces together to have that unified front and look forward to continuing to address this concern. Thank you.
I also want to thank Chairman Andrew Joyce is here. Andrew, thank you too. We were talking last night on the phone and communications in Sue Rizzo's here, our county controller. Thank you for being here. We're mapping this and we're tracking it, and it's going to take time. Unfortunately, our health department and people are turning into investigators because you got to mathematically treat it like a math equation and track who they had contact with and who might else be. So we're in the early stages, and so please forgive us if we don't give you exact numbers, because we can't, because we're still unfolding everything where these two people were, who they had contact with. And as the doctor said, we're alarmed because they didn't travel anywhere. But I'm going to turn it over to Mayor Sheen and talk about the parade for Saturday, and then Sheriff Apple.
Thank you. And again, I want to thank the county. This is how municipalities and governments are supposed to work. The county health department has been in constant communication with us and with other municipalities in the county to ensure that we're aware of what's happening in Albany County, and I want to commend the county executive and Dr. Whalen for that cooperation. As the county executive and I said yesterday, we, at the time that we held a press conference in the morning, were following the CDC guidance for mass gatherings, encouraging people to stay home, and those who were immune compromised not to come out for the St. Patrick's Day parade. This has changed since that press conference. The World Health Organization declared COVID-19 a health pandemic. The governor held a conference and has announced very stringent changes to how SUNY and CUNY are going to operate, and the president has banned all non-essential travel between the United States and Europe. And now we've just learned that there are 2 positive cases here in Albany County. Based on that, the city will be suspending all mass gathering permits that have been issued in the city. We will be reviewing those as the public health impacts evolve, but at this point, all gatherings and permits permitting gatherings are suspended until further notice. So that includes both the North Albany Parade and the main parade in the city of Albany on Saturday as we continue to monitor this. I know that there is, as the county executive said, a lot of information out there, and there are those who are going to be disappointed in this decision. I think that we have to recognize that there is still a lot that we don't know, and that none of us will regret erring on the side of caution. All of us will regret moving forward with something that could be placing people in danger unnecessarily. So I am joined by fellow mayors from across upstate in canceling this parade. You're going to see these announcements. The New York City parade has been canceled. And again, these are voluntary events, and we believe that the best course forward is to avoid placing people in a situation. The concerns that we have also include our public safety, members of our public safety departments. So our police department, which, as people know, is actively engaged when the parade is occurring, as well as our first responders in the fire department. We do not want to unnecessarily expose them potentially to the spread of this virus by holding a voluntary event. So we are going to be suspending that permit, and we have communicated that to the parade committee, and we will continue to monitor this as we look out into the future. We're already getting calls about Tulip Festival, Alive at 5. Those are events that happen in May and June, and as I said, we're going to continue to monitor this along with the rest of the city, the county, and the country as we make these decisions going forward.
Thank you, Mayor. As President of County Executives of America, I've been on conversations with executives from across the nation on this topic to really discuss how they're handling it, what they're doing. We're not trying to reinvent the wheel, but I do want to commend Sheriff Apple for all that he does day in and day out, but especially ironically, he had a drill today that he was going through at 10:30 this morning, or 9:30 this morning, and I had to call him this morning and tell him the news and had to have him head this way. But it shows how proactive he's been in his office and reaching out to other elected officials to let us know how we're handling. This is new, but I do want to tell everyone, don't panic. We're going to handle this. We're going to stay calm, cooler heads prevail, and working with Mayor Sheen and Supervisor Barber and all the elected officials in the room and with our health department, we're going to get through this. But we're going to do this in a way that is best for the community, safe for the community. We already took steps a couple weeks ago at our nursing home, but we took another step today. I know the sheriff took a step at the jail, and it's not to prevent people from seeing their loved ones. It's for this reason here, to try to slow the spread down. But at this point in time, do you want to say anything, Sheriff?
No, basically, until the knowns start to outweigh the unknowns, we're going to, we've limited access at the correctional facility. I mean, we have 400 inmates up there and 400 staffers up there as well. And we need to take care of our public safety, quite honestly, because if they don't stay healthy, there's going to be nobody able to respond. So as we're sitting here, there's a meeting of all the county emergency managers right now out in our Clarksville station discussing plans and preparedness. I know Dishes is out there as well as members of state health and I believe county health. I want to say, though, I'm getting inundated with calls regarding state hand sanitizer. I don't have any. All right? I don't know when I'm going to have it. I know it was thrown out there, but I know a lot of school districts and local municipalities are calling, asking for it. As soon as we get it, trust me, we will be disseminating it. But in the meantime, we will be taking a list. I've posted information out there on how to get it, how to get your contact to us, and also ask for justification. I mean, there's been some outlandish requests as far as, thousands of gallons of it, and they're going to focus on the hot spots in the state and then start to roll out the rest. But I know initially it will be going to emergency responders. So I promise you we'll get it out as quickly as possible. Look at folks, there's no real, to say that, yeah, we're ready for this and let's fight it. There's a lot of questions. It's coming in. We're trying to respond as quickly as possible. But I got to tell you, our emergency management center is up and running. We're going to continue to monitor and work with Dr. Whalen and the county executive and the local mayors. And you just got to trust us on it.
Thank you, Sheriff. So, listen, again, this is going to change as we go forward, and that's what we have to prepare for. So, but at this point in time, I'll take some questions. Mary has the mic. We'll take questions for anyone that you have up for here.
Dr. Whalen,
Jackie.
these are our first two confirmed positives. Do you have a number of tests that they've done at this point? I've asked the governor repeatedly, were we actively testing in these areas that are not known hotspots at this point? And we don't always get a straight answer on that. It's, we'll get you a number, and we've never been given a number. So I'm just wondering, have we been actively testing over the past couple of weeks?
So that's a good question, and the answer is a little bit complicated. As I have let everybody know at the first press conference, initially, all testing had to go through the local health department. When testing went through the local health department, we knew every time a test was done. That relaxed as of Friday, and so physicians are able to order tests. They are not mandated to tell us they've ordered the tests, but we get the results. So the numbers, giving you exact numbers, becomes difficult because I'm not aware of the testing that's being done. I'm only aware when we get the results. I can tell you that testing has actively been done, but I cannot right now give you a number on the tests that we have done in Albany County, because many of these tests have been done by hospitals, by urgent care centers, and others that we are not told about immediately until we get the results. And we expect, as I said, that these numbers are going to increase.
Is there any word on, at the county level or the city level, what will be done in the schools, the K through 12 schools closing down?
We've been working with the school districts, and like I said, as the doctor said, as this continues to grow, we're going to be working with the school districts hand in hand. And we have an obligation first, before we put it out to the media and everyone, we have to cross our T's and dot our I's, meaning that we have to meet with the local mayors, supervisors, and where this is infected, so we can make them decisions before. We don't want people to panic, and that's the message that we're trying to say. Give us time to do our job, give us time to get the information out of there, and as we continue to go forward, them decisions will be made.
Mayor Sheehan, on the mass gathering, so all permits for mass gatherings have been suspended?
That's right. Currently, we're reviewing all of the permits that we've given. I think the next mass gathering is a 5K that is scheduled for the end of March. So, again, we're going to have to review these as we get closer to the dates. But at this point, we're suspending all of them, and then we're going to be reviewing them moving forward on a case-by-case basis.
Would that include like school plays and
sporting
events?
We don't provide permits for those. The school district is completely separate. I do not have any authority over the school district with respect to those decisions. Those are decisions that are made by the superintendent and the school board. But we work very closely with them, and I have been in contact with the school superintendent. They are reviewing at this point in real time what their decisions are going to be. In a district like Albany, some of the challenges that we have is that for many of our students, the 2 meals that they get every day are 2 meals that occur at school. And so we also, have issues with students who are homeless, with, a lot of challenges within the community. And so it is something that we do collaborate on so that we're ensured that we can provide for certain contingencies, but that will be a decision that the school district will make.
Is there a timetable on that?
It's happening in real time right now.
With the 2 confirmed cases, what prompted the testing and when were they tested?
They were both tested on Monday, and they presented with symptoms of respiratory illness, febrile respiratory illness.
So they said there was no traveling, so what prompted the update?
Right. So as I said, Friday the testing criteria changed, and we talked about expanding the test criteria. That gave the decision to test to the provider. and the provider that saw these 2 patients had enough of a suspicion to test them.
Dr. Whalen, have you had a chance to do some of the
Thank you. Have you had a chance to do some of the work backing, if you will, where these folks were, who they might have come in contact with, and is anybody else in voluntary quarantine?
So that's what we do at the health department. Our job is to investigate reportable communicable diseases. We have an epidemiology staff that was called in last night and worked a good 4 or 5 hours on starting that process of identifying individuals who had contact with our 2 confirmed cases. There have been individuals that have been recommended for both mandatory and voluntary quarantine, and those have been put into effect as of last night.
Did this student live in campus housing?
No.
Or campus housing?
No.
Off campus?
Off campus.
And then a separate question for Mayor and the executive. You know, Albany worked really hard to get NCAA events here, and now they're canceled. Could you speak to your reaction to that and what the potential economic impact of that might be?
You know, look, I could talk about the economic impact, but this coronavirus is by far passing that, and I'm not worried about that, the loss from the NCAA tournament. It is a loss. It's going to be a loss to the hotels and restaurants in downtown Albany throughout the Capital District. But most importantly, this is about trying to stop what's going on. And I thought the mayor and I were very, very clear yesterday morning, as thing changes or if someone had it, we have to take the appropriate steps. And that means you're going to see more of this stuff go on, Jimmy, that, you know, unfortunately, you know, look, they weren't here since '03, right? Now we probably won't see them again in 10 years. I'm not worried about that. What I'm worried about is the health and welfare of the residents of Albany County.
I agree. You know, it's disappointing for fans, it's disappointing for our restaurants, but I think that when you look back at history where elected officials sort of took those factors into consideration ahead of what health officials were telling them, we haven't had good results. And so I think it's really important that as elected officials, we listen to what the public health care professionals are telling us, and we do what we can to support that. And you know, we recognize that there are people who are disappointed. We recognize that there are people out there who are cavalier about this, but we don't have that luxury. And we have to think particularly about our vulnerable populations and the fact that this virus, when spread to people who are vulnerable, can be deadly.
Dr. Whalen, can you give us an update on how many people are on quarantine in the county?
I cannot give you those numbers right now.
We were at 20 and 5 yesterday. It's going to be more than that now.
Right. As I said, we are continuing to identify individuals. We're mandated to report to the state every day at 5, before 5 o'clock. So before 5 o'clock today, we'll have exact numbers. But due to the fact that we are continuing this active investigation, I cannot give you an exact number right now.
Like I said, people, it's going to change, but before we end this, because there's no other questions, just remember, 20% of the people walking around aren't even know they have it. The other 20% are going to fight it and get through it, and then you're going to have the population, as the mayor just said, over the age of 60, that are going to have bigger issues, you know, meaning that if you have heart disease, you have lung issues, you have respiratory problems, please take the precautions, stay home, don't go out in public, make sure you wash your hands, and if you're coughing, cough into your arm, and be careful when you're out in public. That's all we can say for now.
Will the county need any access to state or federal funds in the short run or long run?
We're keeping track of that. The governor's, you know, like again, I commend the governor. He's been very proactive on this issue. We're working with the governor's office on that. The feds are putting money out there. We're keeping track of what this is going to cost us going forward, and hopefully we get reimbursed. But if not, these are things that myself and working with the county legislature, you know, we prepare for, and this is what we have to be prepared for these emergencies in this situation.
You mentioned that you get results, but you don't know how many tests have been conducted. So do you get notified if someone comes back as a negative for the coronavirus?
Not always.
And so far, we have 2 confirmed cases. How many negative cases have you heard about?
I don't have a denominator for you right now. I can certainly see if I can get that.
Anyone else before we end it? Thank you, everyone. And again, this is going to be the norm. We're going to be doing more of these briefings and putting stuff out as this continues to go. So thank you.